In Scotland, we've got something called the Health Promoting Health Service, which is focused on the acute sector. And it basically promotes the idea that every contact with a health professional is a health promotion opportunity. And really, by not saying anything, then perhaps you're actually making a health certificate effect. In England, there's something called every contact counts. So we're very aware that health service personnel are very important for endorsing the lifestyle messages of public health. So that people are less confused by thinking the media is their main source, but health professionals are endorsing the sort of messages that we're giving. So within the cancer setting, I think there are opportunities to raise lifestyle issues for the benefit of the patient. And the area that I'm particularly interested in is linking lifestyle programs within cancer screening settings and indeed cancer surveillance settings. So the three areas that we have worked in are the breast screening area, so that's women coming through for routine breast screening. It is, after all, a clinic that many women think is about breast health, so to raise the issue of the links between lifestyle and breast cancer does not seem that alien. The other area is the bowel cancer area, and the full randomised controlled trial that we've done there was offering people who'd had a diagnosis of a colorectal adenoma following a screening programme the opportunity to take part in a lifestyle programme. They have very high uptake, very high retention and very good weight loss, as well as reduction in diabetic and heart disease risk factors as well. And the third area is offering a lifestyle programme for people who are attending family history clinics with a history of bowel or breast cancer. So both bowel and breast cancer are associated with lifestyle factors. It's estimated that approximately 45% of bowel cancer is related to lifestyle. So with that sort of evidence, why wouldn't we talk about that with people who are coming through for investigations related to bowel cancer? It isn't good enough just to investigate and say, no, you don't have the cancer. There's an opportunity to develop a teachable moment there and to offer advice on lifestyle. And for breast cancer, it's probably about 35% of breast cancer is related to three main factors. So being overweight and weight gain in adulthood, being inactive physically, and consuming alcohol. Cancer, of course, is a genetic and environmental interaction, and we hear a lot about genetics in breast cancer, but we really don't hear enough about lifestyle in breast cancer. And many people that we speak to who come through breast clinics say they're totally unfamiliar that alcohol could be linked to breast cancer. Indeed, they say, how can it? Alcohol, breast, alcohol, bowel, or gut, it goes through your system, but breast, are you just trying to make us drink less? A lot of scepticism out there. So my big trial at the moment, which is funded by Scottish Government, is offering a lifestyle programme for women coming through breast cancer screening clinics with two primary endpoints: increased physical activity and weight loss at 1 year. And government have committed to this trial within their cancer strategy and have committed money for rollout if it's successful. So we see an example of where government is prepared to look at evidence, look to see if we can implement that, so it's implementation research with a view to rolling that out, and that's exemplar in the lifestyle arena. These are three of the trials that we've been involved in. All my trials end in the word well, because we want to give the sense that you can feel well after lifestyle change. So the Scottish Government trial that we're currently doing is called ActWELL, so that's for breast cancer risk reduction. The trial for people who had colorectal adenomas, which is published in the BMJ, is called BeWEL. And our pilot work for people attending family history clinics is called LivingWELL.